Hello, everybody. My name is Jean Bastilla. Again, I know some of you may be thinking, am I really coming live tonight, bringing up another topic? Of course, as usual, every day I try to bring a different topic. I'm with AWC Home Care, a home care company in Atlanta that cares for seniors. Again, as you guys know, I have been going through that journey through that campaign of educating people. Today, I'm going to talk about the use of antibiotics. If you stay with me, I'll be able to work you through the process of taking antibiotics. We'll be talking about some very, very important things that have to do with taking antibiotics, whether you are taking antibiotics or you have a family or a friend who is taking antibiotics. We'll be talking about some very significant, very important aspect of taking antibiotics. Again, my name is Jean Bastilla, and those videos are coming up on a regular basis. They are being on all the social medias. Again, after this video, you will still get a chance to go on YouTube on our channel to watch this video. Let's talk about antibiotics use. First of all, we do know antibiotics is a medication that is usually used for bugs, for bacteria, for infection. So when you have infection, this is when antibiotics is prescribed. That is it. Now let's see the use of antibiotics. I know last night we talked a little bit about urinary tract infection. We were talking, one of the point that I emphasized on was the fact that you have to continue to take the full course of antibiotics when it is treated. Let's look at the reason why it is very, very important for somebody to take the full course of antibiotics that is treated. So this is extremely important because many people end up not taking the full treatment of the antibiotic that is prescribed to them. Now, I don't know if any of you have ever heard of antibiotic resistance. So a lot of the time, there are certain antibiotics that do not work for you. How many of you been to the doctor, they prescribe that medication, it works for many other people, but it does not work for you? It means you have resistance to that medication. It means this medication is no longer work for you because you develop resistance to it. So this is what brings this topic so vivid. This is what makes this topic so important, because we're going to talk about why are you having resistance to those antibiotics that many people are very sensitive to. You know, some people, you give them the amoxicillin, it works quick, it fixes the problem. But whereas other people, why they having problem when you give them the amoxicillin, it does not work for them. So let's see why that happens. First of all, we have to understand what antibiotics does. The antibiotics, when you take it, it goes into your bloodstream, and usually they go and help kill the bug or the infection, the bacteria, whatever you have that's causing the problem. They go and kill it. So when you come to us and we prescribe the antibiotics, we dose the medication based on the severity of your condition, what condition you have, how severe it is, and we say this is what antibiotics we will give you, and this is for how long we want you to take that antibiotic. Okay, so this is what we do. What happened is many people, in many situations, when you start taking antibiotics, within a couple of doses, you feel so much better. So people feel better, and they feel that they do not need to take any more of it because, oh, I'm better. Why do I have to continue to take it? My friend, my supporters, people who've been following me, I want to tell you this is extremely, extremely important that you continue the full treatment of the antibiotics. If I say you have to take this antibiotics for 7 or 10 or 14 days, please continue to take the full treatment. Why is it important for you to take the full treatment? Well, when you go and take one dose of that antibiotic. So because what happens, the antibiotics is it goes in there and try to kills all those bugs that are causing you to be sick. So when you take a very tiny bit of this antibiotic, all it does is introduce the antibiotics to those bacteria. It doesn't kill them. It is like you go to a war. You go to a war, you're fighting some people, but all you do, you didn't kill everybody. You didn't kill the whole other party. But what you did, you just showed them the weapons that you have. So this is exactly the same thing that happens when you start taking the antibiotics and you don't take the full treatment. Because what happens is you introduce that medication to those bugs so they get used to it, but you didn't kill them. Because the purpose, when we treat you for all those days, the purpose is we want to make sure that we give you enough medication to totally destroy the germs that are making you sick. But when you go, you give them a little bit, so they say, oh, this is the medication that is trying to kill me. Guess what the bacteria does? They go and develop defense for that particular antibiotics, and that's what causes you to be resistant to it, because all they do, they go back, they say, oh, this is the antibiotics that is trying to kill us. Because remember, bacteria, bugs, all they're trying to do is fight. They are fighting to make sure they stay alive. They're trying every day, they're trying their best to stay alive. So what happened is, because you took a couple of doses, a very tiny bit of the medication, you introduced it, they understand which medication it is, so they go back and reinforce themselves against that antibiotic. So with that, when you try to take it again, it is not going to work, because you didn't kill all those bugs. You only introduce them to the medication, you kind of make them feel a little sleepy if you want, but you didn't kill them. So they were able to wake up and say, this is the medication that was trying to kill me. I'm going to go ahead and be resistant to it. I'm going to go ahead and replicate a defense against that medication. This is exactly what caused us to have so many resistant of so many of our antibiotics, because many people, they do not take the full course of treatment. They take a very tiny bit of it and then they leave. But what you want to do, you want to continue to take the full treatment. When you come to me and I say, I'm going to treat you for this medication, for this condition, I'm going to treat you for 10 days, there's a reason. There's a reason. As providers, we use many things to determine how much medication you need for how long you need to be treated. And usually it depends on the condition. It depends on how bad the condition is. So it is extremely important for you to take the full course of antibiotic, because if you don't, you are creating resistance. You are opening a door for you to not be able to be treated with that medication in the future. Because what you want to do, you want to kill all the bacteria. That's why you want to continue to take the medication even though you feel better. Because in many situations, you will be feeling better within taking a few doses of the medications. So what you want to do is to keep taking it so you can fully destroy the problem, so you can fully cure the infection. If you fully cure the infection, guess what happened? You killed the bacteria, we're done. But if you only take a few doses and you say, oh, I'm better, you move on, you leave the rest. Because so many people right now, if you're watching, I know many of you have so many bottles of antibiotics at home. Oh, they gave it to me, I started taking it, I was feeling better, and I stopped taking it. No, you don't do that. Because when you do this, all you do the bacteria, the germs that try to kill you, you give them a benefit. Because you let them win. You give them that medication, now they know what they are trying to give them, and it didn't kill them. So all they do, they develop a memory system. for this particular antibiotics that did not kill them. And this is how you become resistant to this antibiotics. So it's very, very important for us. And we, as provider, we always tell our patients to take the full course of treatment. But a lot of the time, people have to understand the reason why they have to keep taking the full treatment. Because when they understand, maybe it will make them, it will bring more awareness for those people to make sure they continue to take their treatment. So if you're watching this video, what I want you to do is to go on our YouTube channel, like our page. I want you to like us on Facebook. I would encourage you to share this with as many people as you know, because every one of us can be placed in a situation where we have to be on antibiotics. And I think this is a very good thing for our community when people know, hey, if I'm taking this antibiotic, I have to take the full treatment. I cannot cheat the treatment. So this is extremely important. Explain it to them. Tell them the reason why it is very important for them to complete the full course of antibiotics. If you are watching right now, or if you will be watching in the future, I want to thank you very much for your support. Thank you for watching our channel. Thank you for being there for us. Again, my name is Jean Bastilla. I'm with AWC Home Care. Again, this is a home care company that I work for, that partners kind of support the effort that we're doing, the effort of educating people about health topics, and also seniors, different topics about seniors. If you go on our YouTube channel, you will see many topics we have. Again, please give us a call if you need any help. Our number is 678-696-9905. As I always say, and on this channel here, I always say I do a lot of education. If you know any group of people, especially seniors who need some education, if you need some seniors at home who need some help, who need a sitter or a CNA, please let us know. Again, thank you for being part of what we're doing. Thank you for watching our video. And please continue to share it. Continue to share it with other people who may need that knowledge. Again, as a recap, today we talk about antibiotics. We talk about resistant of antibiotics. We say why people are resistant, because why they resistant is because they do not complete the full course of treatment. So we encourage everybody, when you are prescribed antibiotics, please take the full treatment. Even though you started the condition is getting better, I would strongly encourage you to continue to take the full treatment, because this is what will cause you to have resistance to that antibiotics. And when you really get sick in the future, this antibiotics may not work for you, because what you did, you introduce this medication to the bug and to the bugs that are trying to kill you, and they know it. And anytime you go to the doctor, they give you that antibiotics again, it will not do anything for those bacteria, because they will be resistant to it, because they already developed a memory system that says, we know this antibiotics, we already know how to kill it. So please, your antibiotics, take the full course of treatment. Don't leave the rest. Don't put it in the medication counter. Don't just put it there and say, I get better. It will be fine. Thank you again for watching my video. You all have a great night. Thank you very much. I will see you all tomorrow for another very important health topic.